Heart attacks, medically known as myocardial infarctions, occur when blood flow to the heart is severely reduced or blocked, causing tissue damage or death. In men, heart attack symptoms typically include chest pain or discomfort, which can feel like an intense squeezing or fullness in the chest, and may also notice pain in the shoulders, arms, neck, jaw, or back. Women, on the other hand, often experience heart attacks with subtler symptoms such as shortness of breath, nausea, vomiting, and back or jaw pain, which can be easily mistaken for less critical conditions. Treatment for heart attacks usually involves a combination of medication, lifestyle changes, and possibly surgical interventions like angioplasty or bypass surgery to restore blood flow to the heart. Major risk factors for heart attacks include high blood pressure, high cholesterol, smoking, diabetes, and obesity, with genetics and age also playing a significant role. To understand better how heart attacks can present differently and what proactive measures can be taken, here's a detailed look at the various aspects of the disease. Symptom presentation, typical versus atypical. Heart attack symptoms can vary significantly between males and females, which is crucial for timely diagnosis and treatment. While men often experience the classic presentation of chest pain and pressure, women are more likely to have atypical symptoms such as shortness of breath, nausea, back or jaw pain, and fatigue. This disparity can lead to underrecognition of heart attacks in women, potentially resulting in delayed treatments. Healthcare providers must be acutely aware of these differences to ensure that women receive swift and appropriate care. Moreover, public health education campaigns should highlight the variation in symptoms to empower individuals to seek help promptly. Chest pain character, intense pressure versus subtle discomfort. Heart attack symptoms often manifest differently between males and females, which can impact diagnosis and treatment. Men typically report intense chest pressure, described as an elephant sitting on their chest. In contrast, women may experience subtle discomfort that's easily dismissed as indigestion or anxiety. This disparity can lead to underrecognition of heart attacks in women. Women's symptoms might include shortness of breath, nausea, vomiting, and back or jaw pain. Understanding these differences is crucial. While men might be more attuned to the classic symptoms, women, clinicians, and bystanders should all be aware that a heart attack can present with less obvious signs, emphasizing the need for a gender-sensitive approach to cardiac care. Associated symptoms, arm pain and sweatiness versus chest pain and fatigue. Male heart attack victims often report intense, vice-like chest pain radiating to their left arm, a classic symptom recognized widely. However, women experiencing a heart attack can present a more subtle constellation of symptoms, which can include discomfort in the neck, shoulder, or upper back, and unusual fatigue. This distinction is crucial for timely diagnosis, as the seemingly benign nature of female symptoms can lead to a dangerous underestimation of the situation. Moreover, both sexes might experience sweatiness and shortness of breath, but the intensity and combination of symptoms can vary greatly. Understanding these gender-specific presentations can literally mean the difference between life and death, emphasizing the need for both patients and healthcare professionals to be keenly aware of these nuances. Onset scenario, physical exertion versus rest. Heart attack symptoms can present differently between males and females, particularly in their onset. Men are more likely to experience symptoms during physical exertion, such as chest pain or discomfort that feels like a squeezing sensation or heavy weight on the chest. On the other hand, women might experience heart attack symptoms without the trigger of physical stress and more commonly at rest. Additionally, women often report a wider array of symptoms, including shortness of breath, nausea, back or jaw pain, and fatigue, which can lead to misdiagnosis or delayed treatment, as these symptoms can easily be attributed to less serious conditions. Recognizing these gender-based distinctions is crucial for timely and accurate medical intervention. Risk perception, high awareness versus under-recognition. Heart attack symptoms often differ between men and women, shaping the perception of risk and recognition of the event. Men typically experience the classic heart attack symptoms, such as intense chest pain and pressure, which leads to high awareness and quicker response times. In contrast, women may have subtler symptoms like fatigue, shortness of breath, and nausea, which are easily attributed to non-cardiac causes. This variance leads to underrecognition of heart attacks in women, both by themselves and by health professionals, increasing the risk of poorer outcomes. The challenge lies in educating both the public and the medical community to recognize these differences, ensuring timely and appropriate responses for women experiencing heart attacks.